So on our podcast today, we have Dr. Ken Spear and Lynn Herr, both coming to us from the Vanderburgh County Health Department. Thank you both so much for taking the time to come and talk to us today.
You're welcome.
Thank you for asking us.
I can imagine it is a very busy time.
It is extremely busy. Yesterday we were involved with the business group.
Right.
And we had a large gathering from the hospitals and the health department and put on by the Community Patient Safety Coalition.
Sure.
And we're trying to answer a lot of questions for businesses about what you're going to do if this thing actually gets worse than it is right now, and how they're going to manage. And I know your people were there from the schools.
Yeah, we were. There were three of us who were there, and I will just say I thought it was a very productive conversation. And, it was about an hour and 10 minutes of just people from the community coming together and saying, let's just make sure we're all on the same page.
Right.
So let's just jump in, Dr. Spear. We'll start with you. So as we said before this started, not only is COVID-19 and what we know changing on the day, it's changing on the hour. So as we're recording this, what's the latest that people are listening to us that you would like them to know?
Well, the latest is it still remains a fairly low threat for people in Indiana. We just got the update, and we had 46 cases or tests done in Indiana, and we've had 7 actual cases, all in northern Indiana.
Okay, so 7 confirmed cases.
10 in 7 counties.
10 in 7 counties.
Well, that's the latest because
Yes,
it's changed.
yes.
So
It was just this morning.
okay. So
Right on when we were waiting downstairs.
Okay, so the state of Indiana, 7 counties, 10 confirmed cases, but all from central north, none in the southern.
Exactly.
None below Marion County. So
Okay. So with that information, what should people, and this is for both of you, what do you want them to be thinking about at this point? Because obviously people are concerned. It's in the news all the time.
at this point, if you're sick, stay home. Stay out of crowds. Don't take your illness with you. Stay home and cover your cough. Wash your hands as often as you think during the day, and clean surfaces, especially hard surfaces.
Really, that prevention is key at this point.
Exactly.
Right now, because there is no treatment for this illness.
Okay.
So prevention is the mainstay public health measures right now.
Okay. And I know we talked about this yesterday, and Lynn, if you want to address this, if people are worried, if they would start to develop a symptom, what would a symptom even look like?
So again, this is a wide range of symptoms.
Okay.
COVID-19 can go from no symptoms whatsoever, which is, kind of concerning because you could be spreading the virus and not even know
Early in
you're
the
sick.
period, yes.
But for the most part, it is very similar to the flu symptoms. It's upper respiratory symptoms along with a fever. And the big take-home message is once that kind of maybe goes into some shortness of breath or a little bit worse symptoms, then you definitely need to get a hold of your primary care physician. Don't just show up to the emergency room because, call ahead. All of our healthcare facilities within the city are working hard to get their process in place, but that is making sure that when someone with a possible COVID case comes in, that they're prepared for that case and they're not exposing all those healthcare workers and everyone else in their facility to the virus.
And I know that was stated yesterday by all the representatives from local health facilities, the hospitals, smaller clinics, that go to their website, wherever you tend to go for medical treatment. They all have numbers posted so that you can call ahead and either even have the conversation over the phone or to give them a heads up you're coming.
And they're even offering free video
Telemedicine.
Okay, where you maybe wouldn't even have to go.
Right, where you could talk to a doctor potentially or a nurse practitioner over the television, and they could actually advise you about what you should be doing.
Right. And they did say, did I hear them correctly, that for some people, it would be possible to get COVID-19, have what would appear to be a flu-type illness, even more like a cold illness, and then you would recover and be fine for some people, right?
Oh, the majority of our population is going to do very well. And the great thing about this is so far, COVID has not really hit the pediatric population, which I know you're concerned with.
Sure.
At the rate it's hitting those individuals over the age of 60, those with comorbidities, those with diabetes, those with cancer, any autoimmune disease, those are the folks that are getting hit the worst.
Okay, so over 60,
Right.
and if you have other health
Issues.
going on, Those are the ones that need to be the most cautious at this point.
Right.
What would you say, Dr. Spear, to people right now who are saying, here we're getting close to spring break? Other school districts, EVSC, certainly in another week will be at spring break. What would you tell people who are concerned about? What about travel? What's your recommendation on that?
Well, everybody's kind of poo-pooing travel, and know where you're going, and
Sure.
and know, like for instance, some of the countries you wouldn't want to go to Italy right now. You wouldn't want to go to
Foreign travel.
China, or you probably wouldn't want to get on a cruise right now. I would think might be difficult. And then I would also look around what states have declared emergencies and possibly avoid those also. I think.
So that would be Washington has the high. Of course, Washington State has a high incidence. California and New York have the highest incidence.
Right.
New England area, that tends to be a focus right now as well. But be aware of where you're going, the incidents in that area, and then also make sure that you're doing those same kind of things that you would at home, washing your hands frequently, cleaning surfaces frequently, and covering your cough and keeping that social distance of 6 feet.
And really with that social distance of 6 feet, I know they're talking a lot too about maybe giving second thoughts to large gatherings that you maybe were planning to attend.
We were canceling some of our large gatherings that we were planning, and I just had a call from my wife, and she was asking about something that they're planning in April, and I told her go ahead and cancel it because it's mainly for older individuals who are at higher risk.
And part of that is because this can be spread airborne, correctly?
Yes.
Or is that correct?
It is. It is an airborne spread.
Okay, so if you're coughing or sneezing and you're in close proximity to someone, there is a chance then you could catch this.
Correct.
Okay. Any just final thoughts before we wrap up? I know you two are so busy, I don't want to keep you too long, but just the main thing you want people at this point, based on what we know, to be thinking about with this.
Wash your hands, clean your surfaces, cover your cough with your elbow, and social distancing is the big one.
Lynn, anything else from you?
Just being aware of your family and being conscious of your own health. If you're not feeling well, please stay home. And also remember that it's still flu season. And while
say just
COVID,
a quick piece about that, because I know you want to get a plug in for that.
It's still flu season, and you're much more likely to have flu right now than you are COVID-19. So I don't want people to be afraid. Someone could just have the flu, and we are testing still very much for the flu, and we still have a very high incidence of flu in Vanderburgh County. So it could be that you just have the flu, and more likely that you would have the flu.
And the flu can be serious too.
Oh, of
obviously.
course. We lose individuals every year in this area to the flu.
Okay. But again, that a key piece too, you've both said it, just to say it one more time. If you're ill or your child is ill, stay home until you get better. Okay. Dr. Spear and Lynn, both of you from the Vanderburgh County Health Department, we're going to let you go because I know you've got lots of work to do the rest of the way, but thank you both so much for taking the time to come in.
Thanks for having us.
Thanks for having us.